Hello, I'm Dr. Santosh Kondekar. I am Associate Professor of Pediatrics at Nahar Hospital and I run my ACCA clinic for autism at Baikala. Today we are going to talk about do's and don'ts for parents and caregivers of the epilepsy children. It's very common that parents may not understand the seriousness or may not go through the sufferings what a child with epilepsy goes through. That's why they may not be able to judge exactly what child is facing and what difficulties child is having in day-to-day living and also in the intellectual behaviors in the schooling, or maybe sometimes the depression or humiliation faced into the society by the children, parents, caregivers, or surroundings, or in the teachers or the colleagues, and he may be isolated. So there are many multiple issues which the child may be going through. It's not only about understanding the seizure and giving the medicine on time. It's definitely important. Parents have to have enough stock of the medicine every time whenever a child is having a regular treatment. The parent's responsibility is mainly to give the medicines on time, see to it that there is no chance shortages of the medicines at home, there is no change in the dosages abruptly, there is no under or over excision of the doses, which might create more complications, and the medicines are preferably given time to time, starting from early morning, afternoon, and evening dose, as the case may be, as orders with the doctor. Some children are advised medicines more than one, two, three, four, depending upon the severity of the medicines. It's very important for the parents to understand that epilepsy can come in 25 different forms, and all children, all people's epilepsy is not similar. Each one may not require the same medicine because each one's medicine plan may be different, the number of medicines may be different, and in some cases, the medicines may be keeping on changing monthly, weekly, or maybe 3 monthly, 6 monthly, depending upon the progression of the illness or depend upon the pattern of presentation. So it's very important for the parents that it's a variable disease, although in most cases it may be a simple disease which might require regular medications. Any change of plan is definitely need not be done without consulting the doctor. The changes of plans will definitely be informed by the doctor whenever you visit the doctor accordingly. In addition, the parents have to be ready with the measures that what can be done when the child gets seizure at home or in a public place. They should ensure that the child carries the identity card saying that, okay, I'm having epilepsy and this is the emergency measures if you find me convulsing on the road or convulsing at any public place. The parent should also ensure that the child carries a nasal midazolam spray in his school bag or maybe wherever he goes, in his pocket, in his pouch, so that the spray can be given as the emergency measure if somebody spots him having convulsion at isolated places. Even parents should make a habit that they may also carry a spray of midazolam nasal spray, which might be useful for the child for helping into the getting control of the seizure. It's very important for the parents to understand that the carrying the nasal spray is important for the child and the parent for the immediate seizure control to prevent complications. When a child gets seizure at any public place or at home, the parent's duty is to turn the child to the side and not to hold the child or not to try to stop the seizure or not to do any silly measures like making him smell shoes or onion or something. It's just important to note that the parents should understand to let the seizure pass. Usually, most of the seizures pass by within 1 to 2 minutes, and then the child recovers from the seizure, and then the child can be taken to the doctor for the adjustment to the dosages or for the plan of the action. Parents often have a tendency to probably try skipping a dose and see what happens, especially after a few months of the seizure free period. I always insist that no parents should insist on reducing the doses at least for 1 to 2 years after starting it because these things are important and they require a continuous slow course of the medications which might itself help in the better management of the seizure protocol. Some children do require investigations and these investigations may be important in managing the seizures. What parents should understand that they should not play around with the doses, they should not ignore the treatment, they should not switch the time slots of the medications without permission of the doctor, and they should not skip any medications, and they should always see to it that they will have enough stock at home of these anti-seizure medications whenever a child or any adult is there in the family with the seizures. The other issues, psychological issues, behavioral issues, nutritional issues, educational issues, academic issues, they are sometimes likely possible in children with epilepsy. And the parents' duty to see to it that they will tackle all these things with the necessary referrals. They have to understand that child has to go through this behavioral changes in some cases. Sometimes there will be side effects of the medications. At any new thing is which is noted in the behavioral or maybe in pattern of presentation or any neurological finding. It's important that they have to consult a doctor before adjusting the doses. So it's very important that parents play a key role in helping the child understand, manage, be with this, live with the seizure, and accordingly, they will also help in getting a full control of the seizure to have a quality life without any issues to the child's academics or maybe further development or a social life. Thank you.